Accurate mapping of cardiac electrical activity is critical for effective diagnosis and treatment of cardiac arrhythmias. Intracardiac mapping utilizes specialized catheter probes and mapping systems to record cardiac electrical potentials directly from inside the heart chambers and great vessels. This provides precise localization of arrhythmia foci, conduction pathways, or surviving tissue conducting regions post-ablation. Understanding principles of intracardiac mapping forms the cornerstone of electrophysiology studies and ablation procedures. Comprehensive knowledge of cardiac anatomy and intrinsic conduction system is fundamental to interpret intracardiac maps. 4 chambers: right atrium, right ventricle, left ventricle, and their relationships. Specialized conduction system: sinoatrial node, internodal pathways, atrioventricular node, His-Purkinje system, and their fiber tracts providing normal sequential activation. Major blood vessels: superior and inferior vena cava, pulmonary veins, coronary sinuses, great arteries, and their ostia. Surrounding extracardiac structures: esophagus, phrenic, vagal nerves coursing near heart. Ventricular myocardium, subepicardial, mid-myocardial, subendocardial layers, and their functional blocks. Understanding normal and variant anatomy guides proper catheter manipulation and correct interpretation of electrical data. Selecting appropriate electrodes and their positioning impacts map quality and resolution. Mapping catheters: multi-electrode or spiral lasso designs record local potentials at distal proximal electrodes along catheter shaft. Reference electrodes: skin patch or distant intracardiac electrode like coronary sinus provides reference potential for bipolar electrograms. Ablation catheters: solid irrigated tip electrodes record potentials but also deliver therapy requiring meticulous tracking. Pacemaker electrodes: unipolar bipolar pacing help validate conduction pathways and locate block zones. Vector and directional electrodes, used to determine wavefront propagation direction, map reentry circuits. Optimized electrode stability, tissue contact, and adequate electrode density across target area enhance mapping fidelity. Mapping systems record cardiac potentials using following modalities: unipolar electrograms, voltage between a test electrode and reference determining local depolarization/repolarization. Bipolar electrograms, difference between adjacent electrode pairs determining local activation wavefront direction. Electroanatomical voltages, color-coded isopotential maps depicting low normal voltage areas. Pace mapping, pattern similarity between paced and clinical rhythms localizing origins. Activation mapping, spatial temporal activation sequence depicting conduction pathways. Entrainment mapping, pacing maneuvers to validate reentry circuit characteristics. Integration of multiple modalities at high spatiotemporal resolution gives comprehensive depiction of arrhythmia substrates. Systematic electrogram analysis is key to localizing arrhythmia circuits. Timing activation relative to reference channel surface ECG for timing sites and circuits. Morphology: uniform fractionated signals indicate organized, disorganized activation fronts. Amplitude: low voltage areas indicate scar while normal voltage healthy myocardium. Activation pattern: concentric linear activation delineate arrhythmia mechanisms. Entrainment responses: validate circuits and locate isthmuses for ablation targeting. Correlation with cardiac motion angiography aids precise anatomical interpretation of electrograms. Sophisticated algorithms now automatically localize circuits as well. Modern three-dimensional 3D electroanatomical mapping systems have revolutionized intracardiac mapping. Cardo EnSight system, Biosense Webster, industry leader with magnetic impedance catheter tracking and anatomical reconstruction using import of CT/MR data. Rhythmia HDX system, Boston Scientific, high-density mapping cath, automated mapping algorithms, integration of 3D visualization tools. Easian, Abbott, robotic non-contact cardiac mapping for expedited large surface area coverage. Topera, Abbott, contact mapping using a real-time integrated ultrasound catheter. Viva, Biosense, novel system integrating kinematic cardiac motion modeling for dynamic maps. Key features include 3D anatomical models with registered electrograms, automated contouring of activation voltage maps, multi-electrode mapping, seamless integration of imaging data. They have revolutionized precise localization of complex targets. Detailed substrate characteristics mapped aid identification of ablation targets. Low voltage areas, scar delineation using bipolar voltage amplitude cutoffs. delayed potentials, areas of slowed conduction, fractionation indicating isthmuses. Non-excitable regions, areas not responsive to pacing, demonstrating extensive injury. Fragmented electrograms, disorganized zone at scar borders, reentry isthmuses. Breakthrough sites, areas within scar demonstrating centrifugal activation. Residual conduction zones, regions conducting within scar determining additional targets. Substrate mapping tailors ablation to modify unhealthy tissue driving arrhythmias in a more individualized approach. Important technical limitations potentially affecting maps must be recognized. Contact force issues. Poor contact leads to missed signals, undersampling critical regions. Limited electrode density meets resolution constraints based on clinically usable catheters. Blood flow motion artifacts can obscure fine details requiring motion filtering correlation. Scar border ambiguities, imprecise low-voltage breakpoint identification of transitional zones. Activation timing issues, millisecond uncertainties in timing of large map areas inaccurately. Far-field signals, superimposed potentials masking local signals requiring filtering. Advances continually aiming to minimize these limitations through better catheters, mapping algorithms, and integration with imaging are improving mapping fidelity. Intracardiac mapping forms the backbone of modern arrhythmia diagnosis and therapy. Integrating knowledge of cardiac electrophysiology with principles of mapping catheter design and modalities has significantly enhanced precision of localizing arrhythmias. Continuous innovations, overcoming technical bottlenecks, are optimizing depiction of arrhythmogenic substrates. It empowers electrophysiologists with targeted ablation strategies for curing increasingly complex cardiac rhythm disorders. Further refinements promise to revolutionize individualized arrhythmia management, leveraging latest advancements in catheter technology, computing, and imaging.